All surgical procedures, excluding the cardiology, are being carried out, mostly enlargements or narrowing in the abdominal arteries, on legs or neck area typically encountered in diabetic patients. We can say there are 2 to 3 groups of patients. The first group is open surgery. Second and third groups are completely closed surgeries. In the second group, endovascular procedures are only done through small openings on the inguinal region. The third group is the hybrid ones employing both procedures. Open surgeries are classical ones applied for many years in which the entire body is opened. If this surgery is performed on aorta, the abdominal cavity is opened and an artificial vessel is implanted in there. Closed operations are done through small holes opened on the inguinal area, and the stent combinations are placed inside the aorta and enlarged in there. Since the abdominal cavity is not opened, patient's overall condition is less severe. Particularly following the endovascular surgery, it's a lot easier. Usually the patient can leave the hospital on the 3rd or 4th day. In open surgeries, they can normally get out of the intensive care within this 3 or 4 days. Also, in hybrid operations, the recovery takes place in 5 to 6 days, and they can go back to their daily activities within 1 month. These kind of operations are performed in order to save the life, or better to say mostly save the leg. Therefore, the contraindications are rare. Well, except for the ones whose conditions are so severe to tolerate anesthesia, all the patients can go through the procedure. It's not easy to give an exact percentage. It depends on which vessel the narrowing occurred and what kind of problem this causes in the patient. Sometimes a vessel gets 50% smaller and causes severe problems, but sometimes the entire vein is obstructed but still isn't a problem, so the complaints of the patient himself are important.